What is endoscopic ultrasound, EUS, for pancreatitis diagnosis? Imagine a tiny camera and ultrasound combined to look deep inside your body without major surgery. That's what endoscopic ultrasound is. It's a minimally invasive test that helps doctors see your pancreas and nearby tissues clearly. The procedure uses a thin, flexible tube called an endoscope, which is gently inserted through your mouth, down your esophagus, into your stomach, and into the beginning of your small intestine called the duodenum. At the tip of this tube is a small ultrasound probe that emits high-frequency sound waves. These sound waves bounce off your internal organs and create detailed images of your pancreas, bile ducts, and surrounding structures. This detailed imaging is especially helpful when diagnosing pancreatitis, which is inflammation of the pancreas. EUS can spot signs of inflammation, structural changes, or complications like cysts or masses that might not show up on regular scans. It can also help identify causes of pancreatitis, such as gallstones blocking the bile duct, abnormalities in the pancreatic duct like pancreas divisum, or changes associated with chronic pancreatitis. Sometimes, it can even find hidden tumors that might be causing symptoms. Another key benefit of EUS is that it can guide a fine needle aspiration or biopsy. This means a tiny needle is passed through the endoscope to collect tissue or fluid samples from suspicious areas. This step is crucial because it helps distinguish between benign inflammatory changes and pancreatic cancer, which can sometimes look similar on imaging tests. Compared to other procedures like endoscopic retrograde cholangiopancreatography, or ERCP, EUS is less invasive and has a lower risk of causing pancreatitis. While ERCP is mainly used to treat blockages in the bile or pancreatic ducts, EUS focuses on detailed imaging and tissue sampling without needing contrast dye or duct cannulation, reducing potential complications. In the context of pancreatic health and cancer, EUS plays a vital role. It helps detect early or subtle signs of chronic pancreatitis and can tell apart inflammation from tumors. It's also useful for identifying pancreatic masses at an early stage, guiding biopsies to get accurate diagnoses, and evaluating complications like pseudocysts or duct abnormalities. Before the procedure, patients usually fast to ensure the stomach is empty, and sedation or anesthesia is given for comfort. The process is quick, and recovery is usually smooth. However, because of sedation, patients should arrange for someone to drive them home afterward. In summary, endoscopic ultrasound is a safe, precise, and highly effective tool for diagnosing pancreatitis and other pancreatic conditions. It allows doctors to see the pancreas in great detail, find underlying causes or complications, and obtain tissue samples when needed. This helps guide treatment decisions and improves patient care, all with a lower risk profile than some other diagnostic methods. If you are experiencing symptoms or have concerns about your pancreas, it's important to discuss with your healthcare provider whether EUS might be a suitable option for you.